Hello. Hey, everybody. It's 2 o'clock straight up, so it's time to start the webinar. Welcome. We're happy to have you with us today. My name is Karen Austin, and I'm your host for Manta's Small Business Expert Series. Today, we're talking about healthcare reform. Going to get to that in just a second. I want to thank our experts first, Jeffery, Ingalls, and Roane, for generously donating their time and their ideas and expertise with us today. I want to just mention that when you're tweeting today about today's event, please use the hashtag that's in the left-hand corner of this screen, and that hashtag is Manta Experts. We want to start today with a video. Welcome from our Manta CEO, John Swansiger.
Hi, I'm John Swansiger, CEO of Manta. Thank you for joining our Small Business Expert Series. These events are designed to engage, educate, and inspire small business owners. With tax day behind us and spring and summer ahead, meaningful conversations are emerging around the first quarter of the business year. Today's event covers the shifting sands of healthcare reform and its impact on small business. We'll share our latest research and help you step away from any lingering confusion. Our goal is to answer the most important questions. How is healthcare reform affecting you, your family, your business, and your employees? And how can you use the latest information to gain clarity? Today's program will provide expert guidance even as the law continues to evolve. During the webinar, please be sure to click on the Resource tab at the bottom of the page to register for upcoming events. Thanks again for attending today. See you next month.
Thanks, John. And so back to me, in case you missed it earlier, and in case you maybe weren't on the webinar yet, I'm Karen Austin. I'm your host for today's webinar. I know sometimes when you're attending a webinar, it can feel like you're all alone, but I want to assure you that right this minute, there are 5 Manta team members working on your behalf, and we had 1,000 people register for the webinar today. So you're certainly not alone. And I want to take a few minutes first before we start to cover some important housekeeping items about the tool that we use so that you're using it to its best advantage. So let's first talk about your screen. Right now you should see a slide area, an example of that screen that says hello, that screen that we started with. That should be on your screen right now. Next to that is a media player, under it a box called the resource list and some widgets. The widgets are usually at the bottom of the screen, but placement does depend on what type of the device you're using to view the webinar today. So I'll talk about them as if they're on the bottom of the screen. All of the widgets open and close, so please feel free to play with them during our event. They all do cool stuff, but I want to point out 3 in particular. The resource list, the help widget, and the Q&A. The resource widget is open under the media player. I added the Manta logo there to bring attention to it. I'm going to be referring to the resource list often during our event today because you'll find links and documents there that you can open and explore while we're talking. If you're having any technical difficulties today, like you can't hear or something's not working, please click on the help widget. That's the one with the question mark icon. And my colleague Mel is answering those technical questions. She may be getting a lot of questions, so if she doesn't get back to you right away, please be patient. You'll hear from her. You'll also have a lot of questions today about our material. So once we get going, please ask them anytime. You can open that Q&A widget, type in your question, and while we probably won't answer it until the end of the webinar, the last 15 minutes or so, we are collecting those questions, and we will get to them at the end. So I don't want you to forget what your question is, so just go ahead and type it in as soon as you think of it. Also, directly after the webinar, our experts are going to hang around for a few minutes, so you can ask them questions live on Twitter, and I'll give you instructions how to do that, but Heather will be handling that, my Manta colleague, Heather. So, and of course, we are recording the event, so we'll send you the link to you tomorrow, and you can view it again at your leisure or send it on to someone else. So now let's get started and talking about what you came here to hear about, which is healthcare reform and small business. So I always try to start our webinars with a story about why we're here. We're covering healthcare reform as a webinar topic for a couple of reasons. Obviously, the law impacts every small business, whether you're self-employed or a business with hundreds of employees. It's a complicated law. It's changing all the time. And knowing about and complying with the law isn't something you can set and forget, because the law is a law in transition. So that's the first reason that we're talking about it. Here's the second reason. Recently, last month in March, we celebrated the fifth anniversary of the Patient Protection and Affordable Care Act, which is better known as the ACA or Obamacare, and I will refer to it both ways today. The headline that I just put up on the screen, I put up because it really illustrates what we already know. You know, because I'm researching the topic when we had when the anniversary happened, my inbox was flooded with story after story after story about the impact of the ACA. And what we know is, really, the only thing we know for sure, and when we see some news stories, is that this is still hotly debated. So the debate doesn't alter the fact that as individuals and business owners, you have to deal with it, and the law does impact you in some way. So we wanted to give you a real-world look at what's happening with it 5 years in. So we're going to have a conversation with a couple of folks who live and breathe the business of healthcare reform and the way it affects small business owners, because they're talking to them every day. Here's what we're going to talk about today. First, I'm going to introduce you to Jeffrey and Laura, our experts. And then we're going to take a quick poll, because we always want to know more about you. Then we're going to dive into talking about why it's important to be health insurance and healthcare literate. Following that, we'll talk about the different ways the law is in transition, and there are quite a few. Toward the end, we're just going to talk a little bit about how the Affordable Care Act is already changing the way health care is delivered and administered, and how that may be important to the way you do business and purchase coverage in the future. So let's meet our experts. Both of our experts today are small business owners. Jeffery Ingalls is the president of Stratford Financial Group and Stratford Financial Group and Stratford Employer Services. And he's also the author of Healthcare Reform Made Easy, which he wrote with small business owners like you in mind. Jeffrey wrote the book, he said, because when the healthcare reform was signed into law 5 years ago, he decided he could either bury his head in the sand or figure out how to make it work. So he decided to figure out how to make it work. And he's so generous, as I mentioned a little earlier, that he's offering an updated and free copy of his book to all of you today. So to get that free copy of the book, it's pretty easy. Go to the resource widget that I talked about a few minutes ago, open it up, look for the link that says Get Jeffrey's Book, and send an email to that email address that's there. Jeffrey did want me to remind you that it's a real person that's going to be sending you the link, so it might take a little bit of time. It's not an automated service, but he'll get those books out to you. Our other expert, Laura Roane, calls herself the insurance lady. She has 20 years experience with insurance and finance, and every week holds classes helping business owners get informed about reform. She also works with Enroll America, which is a national nonprofit agency that educates and enrolls people in the Affordable Care Act. So Jeffrey and Laura both have extensive experience, and I'm not going to go through all of it today. For full backgrounds about both of them and links to their various sites, you can click on the speaker widget. I just put something up on the screen about that at the bottom of the platform, and you can also email either one of them there. For today's purposes, Laura will be covering, if you have questions about individual, self-employed, solopreneur kind of questions, those will be for Laura, and Jeffrey will be talking about small business and medium-sized business. Okay, so let's take a quick poll. I want to know a little bit about you and the size of your business. So if you will just answer the question on the screen, are you a sole proprietor? Are you at least one employee but fewer than 25? Do you have 25 to 50 employees, 50 to 100, more than 100? Just submit your answers, and we're going to take a look and see who's here today. Oh, look at that. Okay, so we have about 17% so far that are saying self-employed, nearly 50% under the 25 number, 16% 25 to 57, and 11. So we have a pretty good representation. I'm really glad to see all of you with these high numbers here today. So let's delve into health insurance literacy. It's kind of a new term. It's been in the news quite a bit lately because with nearly 7 million people now buying insurance online, this need for healthcare literacy and health insurance literacy is growing. And both Laura and Jeffrey will tell you that the Affordable Care Act has created a pretty steep learning curve for individuals and companies. In the next few minutes, we're going to talk about various concepts you should be familiar with going forward. And some terminology you may not be familiar with. It's impossible to cover everything, of course. So we've selected a handful of critical basics for you to know about. You may already know some of them, but as I mentioned, this is a law in transition, so it's important to stay informed as it changes. There are some links on the resource widget that will take you to healthcare and health insurance glossaries, so you can really know what the terminology means. And I've also added a link to a recent study from ADP that was kind of interesting, and it looks at the way medium-sized businesses, and there are some of you here today, those with more than 50 employees have been affected by the Affordable Care Act. It's pretty interesting when you have some free time, and I know you never have free time because you're small business owners, but if you ever get there, it's really interesting. You might want to check it out. So one of the first things you need to know about, and this is something you definitely need to have on your radar if you don't have it on your radar now, are the mandates. Obamacare mandates that beginning in 2014, everyone who can afford it must obtain and maintain health insurance coverage. That's called minimal essential coverage, and you're going to hear more about that, but you can find that definition on the glossary that I put on the resource widget. If you don't have health insurance, then you need to get an exemption or you're going to pay a penalty on your federal income taxes. We're going to talk about two types of mandates today. We're going to talk about the individual mandate, which is used by self-employed business owners with no employees, and the employer mandate, which is that requirement that all businesses with 50 or more full-time equivalent employees provide health insurance. We're also going to talk about something else, and there are a lot of you on the call today that are in this space in the middle. These are the folks in the middle who are not required to provide coverage to their employees, but they're often expected to provide coverage to their employees. So we're going to talk about where you and those people fit as well. All right, so I'll stop talking now. I'm going to turn this over in just a sec to our first guest. We're going to talk first about the individual mandate, the provision that requires everyone to be covered, and it's the mandate that affects the self-employed, the solopreneur, the sole proprietor, whatever you call yourself. You're considered self-employed if you have a business that takes in income but doesn't have any employees. So I'm going to turn this slide over to our expert, Laura Roane, to give you the details on that. Welcome, Laura.
Good afternoon, everyone. I hope you are having a great day. It's lovely here in the Northeast. And it's a pleasure to talk to you a little bit about the self-employed responsibility, so if you're self-employed. So if you are self-employed, you can use the individual health insurance marketplace to enroll. You are treated as an individual, so there is nothing that you need to do different from an individual, even though you are self-employed. Once your information is entered, you will know if you can receive any type of subsidy. Everything is based on your projected net income and your household size. So an example is if you're a solopreneur and you're single, your income, if it's not over about $46,000, you would probably receive some type of help as far as paying for your premiums. The less you make of this $46,000, the more subsidy you will receive. So if you are making $40,000, you will receive more of a subsidy than someone that's making $46,000. You also will have to guesstimate again for your income. So there's not a science to this. You do have to guess and project your net income, and that's how your subsidy would be determined. If your income changes and you make more than you projected your income to be, you may have to pay some or all of that subsidy back if you receive the subsidy. If you underestimated your income, you will be due a tax credit when you file your 2015 taxes. So the government is coming in to get theirs from you. So just try to estimate that as best as you possibly can. There are many different types of plans, and it's very important that you know what you're getting. There are 4-tier plans. There's the bronze plan, the silver plan, the gold plan, and the platinum plan. It goes from lowest to highest. So your bronze would be the lowest type of plans. When they developed these plans, they put an emphasis on the silver plan. So with the silver plan, you may be able to get even help with your co-pays and co-insurance, etc. They put a little bit more into the silver plan. So if you can and that fits your need, you may want to go for the silver plan. I'd like to share just a quick story about what's been happening with people. And you might have heard this on the news. People have been going to the marketplace and purchasing a lot of times the lowest plan without really knowing that if they paid a bit more, they would have had access to seeing a doctor without paying a deductible first. So when you go in, make sure that if you want to pay your deductible up front, you can definitely get the lowest price plan. But if you want to have the availability to, say, go to your primary doctor without paying a large deductible first, you want to look at other plans. They may cost a bit more, but it may be worth it to you. I also say use a broker or agent if possible because they can help you understand a bit more about what you're buying. Now, the last thing is the penalties. And I'm sure if you've been to pay your taxes, you've been asked that magical question, did you have health insurance for 2014? So if you did not, you will be paying 1% of your household income over the tax filing threshold. So if someone is a single person, anything over $10,150, they would be looking at that to assess you a 1% penalty. Or you could pay the $95 per person or $47.50 per child. However, the IRS is looking to charge you. Whichever one of those is going to make you pay the most. So they're looking to make a recuperation on that. For 2015, your tax penalty doubles to 2% above that threshold. So again, if you're single, $10,150, you're going to have to pay 2% above that. And they will compare it to the other standard, which is $325 per person or $62.50 per child with a maximum of $975. So those are your penalties, and the IRS is looking to assess whichever one is the highest penalty. So with that said, I'll turn it back over to Karen.
Thank you, Laura. Lots of great information, and I want to, I just put a little thing up on the screen. If you want to know about the individual mandate coverage requirements, there's a great chart on the Kaiser Family Foundation's website. That link is also on your resource widget, so you can check that out. We're going to move to Jeffrey, and Jeffrey's going to talk to us about the employer mandate. This is the one with for businesses with 50 or more employees, which we do have some on the call today, Jeffrey, so that's great. Welcome, Jeffrey, and tell us about the mandate.
Thank you, Karen. Thank you, everyone, for sitting in on the webinar this afternoon. Just a brief overview of the employer mandate. Again, as Karen mentioned, you're looking for employers that are deemed large employers, or what they call applicable large employers, employers that will eventually mean 50 or more. So I do a lot of seminars, a lot of webinars in this capacity, and I think the most important thing to mention is that you need to figure out how many employees you have, because in the many provisions of healthcare reform, there's many, many different definitions of an employee, and you need to make sure that you're applying this calculation correctly. So just as a brief overview for the employer mandate, healthcare reform uses the definition of a full-time employee as 30 hours a week or 130 hours or more a month. So for every one of those employees that you have, obviously each one of those counts as one. For the rest of your employees, or the employees that work under 30 hours a week, under 130 hours a month, those are part-time employees for consideration in the count. What you would do is add up the sum total of their monthly hours worked and divide by 120. Add the first number to the next number, and that gives you your number of what they call full-time equivalent employees, or what's sometimes referred to as FTEs. And that's the number you're looking for to be, 100 or more in 2015, and then 50 or more come January 1 of 2016 to trigger your subjectability to the employer mandate. Now, it's important to note that, as I mentioned, you use part-time employees in the count to determine whether you're subject to the employer mandate, but part-time employees, if they exist once you are subject to the mandate, you are not penalized on those folks. The reverse is true for seasonal employees, and there's a couple different definitions of seasonal employees in the law as well. But seasonal employees are not included in the count, but are included for penalty purposes once you are subject to the employer mandate. A couple other things of relevance here. Employers, must make minimum essential coverage available to employees and dependents. Dependents does not include spouses. It only includes children to the age of 26. So you can make spousal coverage available. You cannot make it available. That doesn't matter. As far as dependents are concerned, at this point, we're only talking about children to the age of 26. Now, the employer mandate is broken down into two parts, two different penalties. One is the $2,000 penalty, often referred to as the no coverage or A penalty. And then there's the $3,000 penalty, also often referred to as the unaffordable or B penalty. Now, what will trigger an employer mandate penalty, and this is very important, is one of your employees being eligible to go to the individual marketplace, purchase coverage, and claim a subsidy. That's so important, I'm going to say it again. What triggers all the employer mandate penalties is one of your employees being able to go to the exchange or the marketplace, purchase coverage, and claim a subsidy. If that doesn't happen, there's no employer mandate penalty. That's the trigger for both. So the way the $2,000 penalty would apply to a company not offering health insurance or not offering minimum essential coverage is in 2015, you would be charged $2,000 annually per employee. You'd be able to subtract the first 80 employees in 2015 and the first 30 employees in 2016 and moving forward. But you would be charged $2,000 penalty per employee, and the penalty is assessed monthly, even though we often refer to it in annual terms. If you are offering coverage and for some reason that coverage doesn't meet minimum value or isn't affordable, which are some definitions we'll talk about in a little bit in greater length, and one of your employees goes to the exchange, purchases coverage, and is subsidized, then you will be charged a penalty of $3,000, but only for each employee that actually goes to the marketplace, purchases coverage, and is subsidized. Again, the $3,000 penalty, like the $2,000 penalty, is assessed monthly, even though we speak about them in annual terms. A couple other things of note, the effective date for the employer mandate is widely touted as January 1, 2015. However, for mid-sized employers, and I think there was 8 or 12% of the folks on the call fell into that category of being 50 to 99, there was one additional year of a mid-sized transitional relief to postpone the employer mandate to 2016. As well, those of you who offer a health insurance plan and have a plan year that runs something other than January 1st to New Year's Eve, you can also potentially be eligible for plan year transitional relief to postpone the employer mandate as well. So with that, Karen, I'll turn it back to you.
Excellent. Thanks, Jeffrey. Well, that's a lot of great information. So we are getting some really good questions coming in, and I'm sure we're going to get some more in just a second. Please continue to ask your questions. As I mentioned, we're going to take them at the end of the call, but we want to make sure that we get them all recorded. So, by the way, one of the things I didn't mention is if we don't get to your question, we do have your email address, and we will send you an answer. Okay, so Jeffrey, now we're going to talk about the effect of the ACA on many of you who are here on the call, those employers with fewer than 50 FTEs, it's not a flower, who are not required to provide coverage. So Jeffrey, tell us about that small business in the middle.
Yes, for those employers that are, between 2 and 49 lives, while not being subject to the employer mandate, there are some changes that small employers started experiencing that came January 1, 2014, or on your plan year renewal after January 1, 2014. And just to roll through those real quickly, because they did have some effects, some positive, some negative, some positive benefit-wise, potentially some negative rate-wise or premium-wise. But all individual and small employer health insurance plans all have to include the 10 essential health benefits. That may not be that big of a deal here in the Northeast, in New York and New Jersey, because we had many of these things already included in the majority of our health insurance plans. But in other parts of the country, that is a big deal. So all 10 essential health benefits all must be present in small employer and individual health insurance plans. And they include things such as the obvious emergency care, hospital care, physician care, but some not so obvious things as well, like pediatric, preventive, dental, and vision, and that sort of thing. As Laura alluded to earlier, all plans are broken down into those 4 neat little boxes of being one of the metal tiers, a platinum, a gold, a silver, or a bronze plan. And that's for comparative purposes. That's so that we can categorize each and every plan, and you don't have to try to figure out, is one plan better than another. All platinum plans, actuarially speaking, should provide very similar benefits, so it makes it a little bit easier to compare. Another thing that we're going to be talking about later, and I don't want to steal later's thunder, is the Small Health Options Program, or what's going to be known as the SHOP, or is known as the SHOP right now, which is the online platform at the marketplace where small employers can purchase health insurance in an online fashion. But we'll talk about that in a few moments. The other things of effect I just want to roll through to make sure that we stay on course here. Small employer health insurance, individual health insurance, all guaranteed issue now. Guaranteed issue means no medical questions. So if you're in perfect health or you're a high claim utilizer, everybody pays the same price without regard to your medical history or your medical profile. We don't use gender any longer to determine health insurance rates in this marketplace, so male-female no longer matters. The only thing that matters is your age and whether you're a smoker or a non-smoker. A lot of states still aren't even using the smoker-non-smoker variance of 1.1 to 1.5, so you can be charged 50% more if you're a smoker. A lot of states aren't using that yet. What we are using is the 3-to-1 ratio for age. So the way these programs are rated is called member-level rating, meaning that small employers typically, in many states, use composite rates. So if somebody was a 20-year-old and they had single coverage, they paid the same single cost as a 60-year-old who had single coverage. Now it's member-level rated, and it's member-level rated by age. So in essence, in many parts of the country, there's 1-year rate bands. So adults between the ages of 21 to 63, a 23-year-old costs X, a 24-year-old costs slightly more, a 25-year-old costs slightly more, so on and so forth down the line. So the actual ages of employees, the actual age of their spouse, the actual age and number of children they have, now all these things matter in a member-level rating environment. So a little bit difference there. Also, from an administrative standpoint and a compliance standpoint for small employers, they have a few extra things to do because of healthcare reform. Many of these things also apply to larger groups as well, but they have to distribute a notice of marketplace options, have to provide that to all new employees within 14 days of their hire date, to tell them about the individual exchange, tell them about the individual marketplace and the potential to claim a subsidy there. Waiting periods can no longer be longer than 90 days, and a precise and exact 90 days. Historically, many small employers had longer waiting periods for new employees, 5 months, 6 months before they became eligible for coverage. Now it's limited to a strict 90 days. The definition of an employee, a lot of states have revised their small employer legislation to mimic the healthcare reform definition of a full employee, to be 30 hours a week, 130 hours a month. Some states had a lesser requirement or a greater requirement to be deemed full-time, but a lot of states are adopting this so that everything's consistent with healthcare reform. And lastly, the summary of benefits and coverage, which is a standardized document provided throughout all insurance markets, large group, small group, individual, throughout the entire country. And it's a standardized document that's typically about 8 pages long, 4 pages front and back, and it outlines the benefits of the plan in an organized and documented fashion, or a mandated fashion. So that the example I like to give is if I'm eligible for a small employer plan in New Jersey, my spouse is eligible for a large employer plan in California, we're both given the same summary benefits and coverage documents outlined the same way. So the same benefits are described on page 1, the same benefits described on page 2. So we can literally lay them side by side, flip through them, and compare the benefits of the two plans in an easy-to-read fashion. Karen, back to you.
Thanks, Jeffrey. I wanted to point out, I didn't put anything up on the screen, but I did put on the resource tab on the resources widget a link to the Kaiser Foundation's. They have maybe it's the ACA, but anyway, it shows you exactly what what that looks like, that format that Jeffrey was just talking about. So we're getting some really great questions. So I'm going to speed through this next thing because I want to get to your questions. It's really important that we have some really good ones coming in. So we're going to talk about the exchanges so you know about them. This is one of those things that you need to be literate about because it's going to change, and it is changing. So I'm going to give you some quick basics about the exchanges. They're also called marketplaces. There are two types of online marketplaces or exchanges. The first is the individual exchange, which is where the self-employed can purchase a plan. This is offered federally and by certain states. And this is one of the exchanges that was created by the Affordable Care Act. The other is the Small Business Exchange, is a shop, which Jeffrey referred to a few minutes ago. We're going to talk a little more detail about that in just a second. The shop exchange was created to give small businesses with under 50 employees more options. It hasn't happened yet to the extent that it's going to, but we're going to talk about that in a second. There is a tax credit for small businesses with less than 25 or less employees. It's a pretty hefty tax credit. If you want to know about whether or not you're eligible for that, you can click on, there's a resource widget to learn about estimating that shop credit. And then there's also something called private exchanges. Now, private exchanges are not part of the Affordable Care Act. This is not required by the Affordable Care Act. Private exchanges are online platforms that may be created by an insurance company, a group of insurance companies that offer different plans. You're going to hear a lot in the news lately, or coming up probably, about private exchanges. I've seen a lot in the news in the last couple of weeks about the increase in enrollments in private exchanges. If you want to know more about that, ask a question. If you want a link to something, actually I did put a link to the Kaiser Foundation on the resource widget about that. But if you have questions about that, just add those to your questions today or email us with the question. All right, so before we move on to what's happening in the other changes, I want to point out some health insurance literacy resources that will be really helpful for you. I want to direct you again to the resource widget where you're going to find these links. Many of you have employees who need to know the basics about insurance and how it works. And the Kaiser Family Foundation has created some short videos that can help. They're pretty clear and direct. They're fun to watch. You can find that link here as well, and it will help your employees understand how health insurance works. Now we're going to move on to how the ACA is changing, but before we do, let's take another quick poll because I want to ask you a question that I'm sure all of you have an opinion about, and that's rising health care costs. So since your last renewal, here's a poll, I'll just put it on the screen again. Since your last renewal, has your health insurance premium increased, decreased, stayed the same? Let's see what people have to say. Oh, look at that. 95% say theirs has increased and 4.2% nobody's costs have gone down. So let's talk about that. We're going to talk about the ACA as a law in transition. We're going to talk about costs. We're going to talk about the exchanges. We're going to talk about states and the law and some disruption of business as usual. The note that I just put up on the screen is a headline from the Sun Herald that talks about how the Supreme Court decision can change what's happening. And Jeffrey's going to tell you about that in just a second. So let's talk about costs in transition. I just just changed the slide, and 77% of Manta latest research, small business owners in Manta's latest research told us that their premiums had gone up. So we often hear like, yeah, my costs are going up. They're going up because of Obamacare. But what's the real story here? Why are costs going up? There has to be more detail. Jeffrey, will you address that for us?
Sure. And speaking in generalizations, I think healthcare reform did a lot to improve the access that individuals and small employers have to healthcare benefits. I think healthcare reform did a lot to make the benefits that are offered very robust, very widespread, so they hit a lot of different benefits for a lot of different folks. So I think we expanded the coverage, we increased the accessibility of the coverage, and I think those two things came at a cost. I think as you see on the bullet points there, we're not really full-blown consumer-directed health care. Yes, some folks may have a high-deductible health plan. Some folks may have a deductible first type plan where they use a health savings account to fund that deductible. But I think those folks are still in the minority. I think what's really behind the increased costs when you speak in generalities across the nation is that we went from an individual and small employer marketplace that may not have been guaranteed issue previously, meaning that insurance may have been underwritten. They may have asked medical questions. They may have turned people down or canceled people upon renewal. You may have been in a small employer plan that rated you up based upon the collective medical profile of your group. None of those things can occur anymore. Healthcare reform did away with all of those things. So now we're in this purely guaranteed issue marketplace where everybody's guaranteed coverage and everybody's guaranteed the price of that coverage. So that price of that coverage is obviously got to be a little bit higher. There's also some new taxes and items that were implemented in 2014, pre-core fees, the health insurance tax, reinsurance fees. All those things added, 3 to 5.5%, depending on who you talk to your premiums, just for the implementation of those taxes. The inclusion of essential health benefits, as I mentioned before, all individual and small employer plans now need to include all 10 essential health benefits. So a 60-year-old individual may not need maternity benefits. Maternity benefits are in there. There's a lot of other benefits that are nice. It makes it for a very robust health insurance plan, but it also makes for an expensive health insurance plan. So I think we've seen that. I think the silver lining, if there is one, and now, again, we just ran a poll where 96% of the people roughly said that their health insurance rates went up. I would gather if we ran another poll and said, were you pleased with your health insurance rates before they went up, probably also get 96% saying no. But I think the rates are probably going to begin to level out. A lot of the plans that are online now that are in the individual marketplace, in the small employer marketplace are cost-sharing plans. They have deductibles. They have coinsurance. They have some level of cost-sharing on the big-ticket items such as inpatient and outpatient hospitalization. So I think that will serve to help level out the costs. And lastly, I think this member-level rating that I spoke about earlier, where people are being charged, the specific premium based upon their specific age and the number of kids and the age of their spouse and that sort of thing, will also help costs to level out. It allows actuaries to price things a little bit more accurately and pinpoint, so they don't have to get these big rate increases or these big rate increase swings upon renewal. So you may not be thrilled with the cost of health care. You may not be thrilled with your most recent renewal, but I think the future renewals will be far more sustainable than the kind of helter-skelter big numbers, double-digit numbers that you've seen historically.
Great. Okay, Jeffrey. So I mentioned earlier, and Jeffrey and I both referred to this, that there are some changes happening with the exchanges, and in particular, it's the shop exchange. Jeffrey, you believe the shop exchange is not as robust as it's going to be in the next few years. Will you tell us about that?
Sure. I think there's some limitations to the current SHOP, the current Small Health Options Program. And again, this will vary a bit based on what state you're in. If you're in a state with a state-run marketplace, you might be a little bit further advanced in this process. But the majority of states have a federal marketplace to one extent or another, or use quite simply the SHOP that's embedded into healthcare.gov, and it has some limitations. The SHOP came upon us in January 1, 2014. It was meant to be an online experience. It wasn't an online experience in those federally facilitated states. You still had to fill out paper enrollment forms and apply via paper, which runs afoul to what it was intended to do. We hoped that this would be taken care of January 1, 2015. You can enroll online. However, you can still only have one plan from one carrier. Now, most small employers offer a choice of plans to begin with, usually two. So being limited to one plan from one carrier, again, kind of flies in the face of what this was intended to do. However, come 2016, or whenever this runs and is implemented to its full capacity, I think the SHOP will be a great thing for small employers. I think small employers are stressed and taxed, obviously, with their dollars and their revenue, but add healthcare to their plate, and it becomes this very paternalistic thing that they need to figure out. They need to figure out what carrier are we going to have, what plans are we going to offer that I can both budget for as a small employer and I can accommodate my employees and their really widespread, varied needs of themselves and their families. So what the SHOP will do is allow you to offer all the plans that are available on the marketplace all to your employees. So what does that mean? Let's say we're in a state and there's 4 insurance carriers that are participating in the shop, and those 4 insurance carriers all offer 10 plans. With some limitations, you can basically offer all of those plans, all 4 carriers, all 40 plans to your employees and get one list bill. So they can go online, peruse the plans, look at the prices, evaluate the differences, and pick what they need from what carrier, and you'll get one list bill as a small employer. I think that takes the ball out of your court, makes it more of a personal consumption for your employees, and takes you out of the paternalistic challenge of having to decide what plan is going to accommodate the most amount of people. So I think in the long run, if we give it time and we allow it to come to full fruition like it's intended to be, once it's up and running to full capacity, I think it's going to be a great thing for small employers and make the health insurance buying process far more reaching and much more beneficial to the employees that you're trying to insure.
Excellent, Jeffrey. Thank you so much. So Jeffrey has referred several times to needing to know what's going on in your state. So let's cover that, just the basics. So, we talked about 4 types of marketplaces. It's important to know which type of marketplace exists in your state because they're not all the same. The type of marketplace that exists in your state determines how you enroll. You don't have to enroll through the marketplace, but the marketplace is there to make it easier, and clearly it's being used, especially in the individual marketplace. 3 states also offer a state-based shop marketplaces, which may give you additional options. Only Mississippi, New Mexico, and Utah offer those. And there's also a lot of stuff going on with Medicaid expansion in various states that's in play. As additional states consider whether or not to implement the Medicaid expansions, some of them are considering tying expansion to work requirements, so that may have some effect on small businesses. If you want to know what's happening in your state, you can link to the Kaiser Foundation's table of state-based marketplaces and the resource widget. It's interesting. It'll show you exactly what's happening in your state. And if you want to pay attention to what's going on with Kaiser, they do a state update quite often for the various states involved in the marketplace issues. So also, and this is something that we referred to a little bit ago, is King versus Burwell. This is a case that was heard by the Supreme Court in March. Now, the case doesn't challenge the actual Affordable Care Act, so it won't strike it down, it won't make it illegal, but what it does is challenge an IRS regulation interpretation that allows the payment of subsidies to people who purchase health insurance on exchanges. So it's about 4 words in the healthcare law. But if the Supreme Court disallows those subsidies, most federal people will lose. They will be unable to afford their insurance. So that's what that's all about. The thing is that it is the subsidies that trigger the ACA's mandates. So Jeffrey's going to talk to you about the effects on the employer mandate, depending on what happens with King versus Burwell.
Yes, thanks, Karen. Basically what we're talking about here is, again, we're talking about the Patient Protection Affordable Care Act that originally was 2,409 pages long, and within those initial 2,409 pages, it always referenced subsidies being available in state-run marketplaces. I think it was under the guise that every state would develop their own state-run marketplace, as opposed to defaulting to federally facilitated marketplaces, which, as we showed in the previous slide, 2/3 of the country elected to do. So it came to pass that it's being challenged that if you're claiming a subsidy in a state that doesn't have a state-run exchange or marketplace, such as New Jersey, is your subsidy valid or is it not? Because, again, the law only refers to subsidies being available under state-run marketplaces, not federally facilitated marketplaces. So the effect that would have on the employer mandate is, as I mentioned earlier, what triggers all the employer mandate penalties is one of your employees being eligible to go to the marketplace, purchase coverage, and claim a subsidy. If that doesn't happen, there's no penalties. The employer mandate can't possibly be triggered. That is the sole trigger of the employer mandate. One of your employees being eligible to go to the marketplace, purchase coverage, and be subsidized. And what's being challenged here is in those federally facilitated states, if we do away with the subsidies, because there's not state-run marketplaces. If we do away with the subsidies, we will in essence do away with the sole trigger of the employer mandate. So those states that are federally facilitated would not have an employer mandate. So it's a big decision and definitively something to keep your eye on. A, if you're claiming a subsidy in one of those states, and B, if you're an employer in one of those states that's currently or will be in the future subject to the employer mandate.
Okay. All right. So we currently have 30 questions on the log, so I'm going to speed through the next slide. Here's what I want to tell you. This is our last slide, by the way. Healthcare, the ACA, Obamacare, call it what you call it, is disrupting the way healthcare is offered, delivered, health insurance is offered, health insurance is delivered. There are a ton of changes going on. There was a recent study from the PricewaterhouseCoopers Health Insurance Institute that went on for quite a bit about all of these different disruptions. You know, health insurance is going retail. It's completely different than it was 5 years ago. It's getting more competitive over quality and price. The industry is becoming more responsive to customers as customers begin to pay attention to costs and what's going on. Part of the ACA is designed to try to increase care, get higher quality care at a lower cost. So what's happening is some larger companies are beginning to pursue healthcare partnerships with industry leaders. We're seeing more do-it-yourself kind of healthcare, telemedicine, where you call your doctor and your doctor diagnoses you. And there's even some legislation to help get insurance to pay for those kinds of things. The younger generation, the millennials, are beginning to expect a different way of insurance delivery and medical delivery. And there are some startups that are beginning to react to that. In fact, the Research Institute study said that there have been 90 startups that have been instigated begun since the healthcare law went into effect. It's a really interesting study. I put a link on the resource widget. The other thing is there's a new study just came out last week about small business and using retirement benefits as a carrot for better quality employees, higher quality employees. So that's something to look at too. I put a link to that study on the resource widget as well. So I know small business owners like to do their own research. We've given you plenty of opportunity to look for that. So now let's go to questions because they're important. We want to make sure we answer them all. So I did mention that Jeffrey and Laura will be on Twitter immediately after, and you can also connect with other business owners in the Manta community. There's a link on the resource widget for that. You guys learn a lot from each other, so that's why we have the Manta community available for you. So the first question, I'm going to give this one to Jeffrey. The reason I'm answering this question first is because it's the first one that came in. So here's the question. How can the ACA affect me when I don't have employees? Are we talking about future possibilities or current principles health insurance mandates?
I think today we're talking more about current principles, employer mandates, affecting health insurance plans that are in effect right now. If you don't have any employees and you're a sole proprietor, I think you're being kind of regulated to that individual marketplace. And I think a lot of the other questions, as I peruse through a few of them, have to do with sole proprietors or husband and wife groups, or LLCs, smaller LLCs or pass-through corporations that were also previously been allowed to establish groups, a two-life group. Husband and wife were a two-life group as opposed to purchasing health insurance. However, as I mentioned, many states have taken it upon themselves to recalibrate their definition of an employee to match those found in healthcare reform, typically those found in the employer mandate and those found in the small business tax credit provision. So they've kind of recalibrated their definition in their small employer marketplace to match those definitions. And under those definitions, those folks aren't employees. So a husband and wife who are owners in a pass-through corporation such as an LLC or an S corporation are no longer employees. So you're not a two-life group, you're really a zero-life group or a zero-employee group. So I think it'll just affect where you get health insurance. I don't know if you're a five-life group, you don't offer health insurance. I don't think there's any thing you necessarily need to be concerned about right now or in the next year or so. Keep an eye on that. I just think where your employees actually purchase health insurance outside of the company would be affected, but I don't think there'll be any direct effect on the business per se.
Okay. So here's a question about if I want to offer employees the ability to cover their family as well as themselves, is that available through the SHOP marketplace? If so, does the tax credit apply for the family members that are covered too?
If that's for me, I mean, the small business tax credit, you have to meet a couple of criteria. One is how many employees, less than 25 full-time equivalent employees. You also have to meet certain income. You know, the average income needs to be $50,000 or less. And you also have to make a uniform employer contribution, meaning the employer's got to pay for 50% of the premium. All right, that only refers to the small business tax credit. I see other questions in there referencing how much the employer needs to pay. But if we're talking about the small business tax credit very specifically, it's a 50% contribution. So the rest of the premium, whether that's premium for the employees or premium for the employees' dependents, all of that would be eligible for the small business tax credit. And the small business tax credit, as I'm sure the links that you have up there, Karen, will display, is kind of a sliding scale. So the less number of employees you have and the lower the average income is, the higher the tax credit you get on the premium portion that you're paying for as the employer.
Okay. This is a good question, and I think this is for you, Jeffrey, because it's about the under 25 employees. Under 25 employees, am I, as an employer, able to help my employees pay for their health care?
You're able to help your employees pay for their health care by, establishing a group health insurance plan and, making an employer contribution towards the health insurance plan. I think what the question intends to ask specifically is, can I say, hey, look, I got 20 employees, and say, hey, look, 20 employees, go to the marketplace. For those of you that purchase coverage, I'll offset the cost of that. And that's something that's been widely disputed and sort of shot down numerous times. And then they kind of said it was okay at one point. So it's a very confusing thing. But I mean, I can answer that question probably for the next hour. But the short of it is, it's really not a good idea to be doing that, to reimburse employees for that. If you want to give every employee a $400 raise and tell them to go get health insurance, that's great. But you got to give them the raise whether they get the health insurance or not. I don't think it's a good idea just to subsidize those folks, with pre-tax dollars who go and purchase individual health insurance, because in essence what you're doing is creating a group health insurance plan whether you think you are or not. Just the reimbursement of the premiums sort of does that, which opens you up to other penalties and so on and so forth. So again, I'm trying to condense a very elongated answer down to 30 seconds or less, but it's generally not a good idea.
Okay, so I'm not sure which of you would be the best for this question. There are a couple of questions like this in the list of questions that kind of refers to how the healthcare industry treats exchange health plans. So I've heard this like several times today. Here's one of the questions. In New York City, exchange health plans are not taken at many of the best hospitals like Sloan Kettering. Why does that happen? Does that happen? I've heard it a couple times today, so I'm just wondering which one of you wants to address that.
Well, health insurance companies have many different plans, and those many different plans, whatever they offer on the exchange or the marketplace, they also have to offer outside the exchange or marketplace. I saw another question asking that. So many times, the total offering of an insurance company, they may offer 20 health insurance plans, and five of those are available on the exchange. So generally what they put on the exchange is a mix of platinum, gold, silver, and bronze. Sometimes it's just the lower three tiers, but a lot of times you're seeing the more cost-effective plans being put on the marketplace, and insurance carriers offering a more robust portfolio of plans outside of the marketplace. But that's really just a function of the plan design, and the network, the managed care network of participating providers that particular plan belongs to. I don't think it's a case of let me just offer these skinny down network plans on the exchange. It might just end up working that way because those plans are more affordable, and that's what that particular carrier has chosen to put on the exchange. I would tend to agree in New York City. A lot of the bigger, more robust networks offered by Empire or Oxford Health Plans, United Healthcare, you won't find those on the exchange. You'll find Oxford Health Plans, Liberty Network, and some of Empire's skinny down networks, and Oscar, and that sort of thing. So I think what you're asking is accurate. I don't know if it's intentional other than trying to put the more competitively priced products on the marketplace.
Okay. This is something that's been asked in a couple of different ways on our list of questions today, and it refers to, I think, Laura, you can take this one, whether or not individual independent contractors count as employees.
They can be counted as employees, especially if you're directing where they go, where they actually have to work. Now the Department of Labor is like looking at that and saying, okay, these are really employees for you. They're not independent contractors because you're telling them where to report to work every day. So that's an area in which you really need to consult about, because Department of Labor has really been looking at a lot of, I know of a few temporary agencies. They're coming up with these issues where the Department of Labor is now saying, they're reporting every day where you tell them they're not considered independent contractors. These are employees to you. So that is something that you need to look at on an individual basis for your business.
Okay, great. I'm not sure which one of you is best for this. What if I work for a company based in Minnesota, but I live in California? The company is very small, only the owner and 2 employees, including me, and the other 2 workers are local in Minnesota. Is that person affected?
I mean, I think they would only be affected by, I don't think there's any healthcare reform implication on the surface based on that question. They might be somewhat affected based upon plan design or the network, or if they're using a national program with a national network out of Minnesota, or if they're using a more local carrier or a more local network, their network accessibility might be affected. But I don't, on the surface of that question, I don't see any healthcare reform implication to be concerned about.
Okay. All right. Let's see. We're getting some other, there's a lot of questions here. Our business has about 8 employees. That includes 2 who are owners. As I understand it, I do not have to offer full-time employees health coverage, correct? That's correct. I can answer that one. And they asked if there'd be any penalties for our business if they do not offer full-time coverage. There is not a penalty for them to not offer full-time coverage because they're not under the employer mandate, correct?
Correct.
Yes, correct.
Okay. How about a corporation that is only 2 employees, husband and wife? Do we have to pay a higher rate on the individual plan versus a group rate? There are a few group questions here, and I think that this is a good place to talk about that. Jeffrey, you mentioned the difference in groups.
Yeah, that's really going to be based upon the state that you're in and how they filed their rates. A lot of states have different, again, a lot of the things we spoke about today, such as the 3-to-1 ratio for, age when it comes to premiums. A lot of those things are national provisions of healthcare reform. And a lot of times those national provisions of healthcare reform are altered by pre-existing state legislation. Like the previous question asker, for lack of a better phrase, was from New York. New York has pre-existing legislation that prohibits the use of age as a rating factor. So they don't have this whole member level rating thing I was talking about because they had legislation already on the books that prohibited it. So a lot of times you could have a state where the individual premium and the new member level rated premium on a group plan are exactly the same. However, in other states like New Jersey, they would not be, because in New Jersey, we use a 2-to-1 ratio for group and a 3-to-1 ratio on the individual marketplace. So depending if you're younger or older and where you fall on that age curve, the rates are not going to be identical. So again, as we mentioned in one of the slides earlier, I think we've spoken in generalities and we've spoken nationally about healthcare reform this afternoon, but you really need to drill down to your exact state and see how they're working this, see if they have any pre-existing legislation that might alter the generalities that we spoke of today. But it can be the same, but it's not always the same. So I hate to give ambiguous answers to people, but unfortunately this one calls for it.
Well, there is some ambiguity here, so we appreciate that. We are straight up at 3 o'clock, and so I'm going to go ahead and close the webinar now, but I want to let everybody know that we will, if we did not get to your questions, we will get to them, and we'll send you an email. And if you have additional questions that we haven't answered today, please send an email, and we will do our best to get the right answer for you. You can find out about our upcoming webinars. The next one is in May, on May 21st, and that is about social media return on investment. We're going to talk to Susan Tucker about that. She's our expert next month. So I look forward to seeing you on the next webinar. And if you're interested in talking to Jeffrey and Laura about some additional questions on Twitter, hop on there now, and we'll get you some answers there. Thanks, everybody. Appreciate you coming here today. Hope you learned something, and we'll see you next month.